So let's try and make sure we are in a very serious area here, and I think we must know that the use of the mask and distancing is really meant for such situation. Okay, so we've just come to this Steve Biko and the Tshwane District. We basically came to just give support to the team. We also came to look at what the situation is, because there have been a lot of reports that the hospitals have run out of beds and so on. It's the same type of issue that we're dealing with last time, where the hospital is not full yet, but what happens is that the delays get to be here at the point of triage. And so from that perspective, we then want to get a sense as to how that matter is being handled. I think we're quite at this point we are quite satisfied that a lot of work has been put into it. Firstly, the triage system is well in place now. The experience on dealing with COVID is also well in place. But I think the issue that we want to expedite is the use of antigen rapid tests to make sure that we can shorten further the waiting time for the patients who are here, who are patients under investigation. It's very, very important that we must deal with the speed with which people can be moved away from the observation ward. That's the key issue. But the arrangement is now in place that if the hospitals are filling up, the beds are filling up, patients can be moved to Nasrec, and therefore there's still enough space at the Nasrec side. The Premier was here. A lot of work has been done. In particular, the issue of the shortage of staff was resolved, and I was just giving a report now that yesterday they interviewed a number of people. They'll be starting to work as early as today and tomorrow. Over 33 nurses who are actually employed on an urgent basis. So we will be responding quickly to match the increase in the numbers of people who have got COVID-19. We have been expecting that there would be an increase in the numbers, particularly during the first and second week of January, and that has actually happened. Although right now we are getting an impression that there's a little bit of easing of numbers, we think the issue is the impact of the social distancing, the use of masks, sanitizers, and so on. So that we want to encourage our people to focus very strongly on, because it's important to know that the way to deal with the reduction of the transmission is to actually use our masks and also social distancing. We will be going on to Charlotte Maxeke. At this point, we just came to have a look at how things are happening in this particular part of the province. But we must say that there's a good spirit. At least one thing that's important. The staff may be exhausted because they've been at work for all the time. But what is important is that everyone is very confident. They know what they're doing. They're very experienced. They don't fear COVID-19 like at the beginning. And we've met with the workers. The labor unions are cooperating, working well with the management. They have actually told me that the PPEs are not the issue. If there is an issue, they raise it every day. That's really what I'd like to see. Whether it's workers, unions, or it's staff, whether it's management, if there's a problem, they must raise it immediately. So from that point of view, as you can see, we've got a team here that's actually beginning to feel that they are going to triumph over the COVID-19. Yes, the numbers have been going up, and sometimes we lose some of the people because of the complexity of the situation, but at least we've got here soldiers on the ground who are brave, who are confident, who are focused, who are determined. They are determined to fight COVID-19, and we will therefore be bringing in the next few months, from next month, we should start the processes of vaccination to give them an additional boost to their safety, so that they can avoid getting infection as easily as what has happened now. So from that point of view, we just want to say thank you to the team here. We want to thank all the staff, the management, the unions, because they're all cooperating and working together as a team. There are obviously going to be challenges on a day-to-day basis. Important thing is to be able to work in partnership to be able to resolve those. We want to therefore send the message to our communities out there. Our hospitals are ready, are open to be able to treat people. They have indicated here that they are treating a lot more of younger people. We have indicated that of late, because of the increased number of people who are having the infection, so we're seeing more younger people who are infected. And from that point of view, we want everyone to know to stay safe, use your mask, keep the distance, sanitize, don't take any chances. COVID is serious, and therefore we want to say to all of us, it's in our hands. We can deal with COVID, we can reduce the spread, but it's all in our hands. So for today, therefore, we will be seeing this province. Tomorrow we'll be visiting Limpopo, and again, it's just to make sure that we want to see the level of readiness, what are the challenges, what can we do to help and support. But in addition, we also want to say thank you to our health workers who are in the forefront. Thank you for their courage. Thank you for their devotion. Thank you for their hard work. Thank you for standing up there and making sure that they keep our people safe and they save lives. Thank you very much. We'll meet at Charlotte Maxaga.